Good evening, everyone. My name is Renee De Silva, and I would like to welcome you to Arthritis and Osteoporosis Victoria's community webinar series. Tonight's webinar is on the subject of parenting a child with a chronic illness. Before introducing our presenter for tonight, I just have a couple of housekeeping issues to run through with you. Firstly, I would like to acknowledge and sincerely thank AbbVie Australia, which has provided the financial support for the conduct of this webinar tonight. If you have any technical difficulties during this webinar, please refer to the message box on your screen. On the left-hand side, you can type a message at any time that will be read by our webinar organiser at Redback Conferencing. If you are listening via phone, you will notice a small time delay between the audio and the screen. This is normal, so don't be concerned. Also, whilst our presenter will answer any questions after the completion of her presentation, you can actually type questions for her at any time. Simply type your question in the message box on the left-hand side of your screen and press enter. Can I suggest that you don't leave your questions to the last minute, as we will aim to finish no later than 8 p.m. Eastern Standard Time. I would also be very grateful if all participants could take a moment at the end of the webinar to complete an exit survey. It should only take approximately 30 seconds to complete. I would now like to introduce our presenter for tonight, Dr Alina Morawska. Dr Alina Morawska completed her PhD in clinical psychology at the University of Queensland in 2004. She is now the Deputy Director of Research at the Parenting and Family Support Centre at the University of Queensland. Her research interests are in the area of prevention and early intervention of child behavioural and emotional problems, particularly for chronic childhood conditions, and she has published over 50 articles and book chapters. Without further ado, I'll hand proceedings over to Alina. Thanks very much, Alina.
Thank you, Renee, and thank you very much for inviting me, and welcome to everyone out there listening to this webinar. I've just realised that I'm actually sitting and I'm tethered to microphones, and I'm used to standing when I present. So I will do my best to try not to wave around and move around too much to not be distracting. So first of all, I wanted to acknowledge that my research is supported by the Australian Research Council, particularly that related to children's chronic health conditions. I also wanted to just let you know about the PPP Positive Parenting Program, which is owned by the University of Queensland, and there's a company called PPP International, which is licensed to publish and disseminate the program worldwide, and royalties stemming from the published PPP resources are distributed back to authors and to the university. Now, I'm employed at the Parenting and Family Support Centre, and I am an author of various PPP materials. I just wanted to also acknowledge all my collaborators, students and research staff without whom this sort of research that I do would simply not be possible. So the list there, I hope, is reasonably complete, but there are many, many people involved in what we do. So let me begin by giving a bit of a summary of what I wanted to cover today. So first of all, I'm going to talk about children's chronic health conditions and their relationship to children's behavioural and emotional problems. I also wanted to talk about the role of parents and parenting in the context of chronic health conditions, and then spend probably as much of the time as we can on talking about what parents can actually do to help children manage their, so that they're well adjusted and well behaved. What I wanted to make sure that I made clear right at this point is that my focus in today's presentation is really going to be fairly broad. I'm not going to talk about any specific chronic health condition. I'll give examples from different health conditions as we go through, but this isn't designed to be focused on any particular health condition. Now, there are a number of reasons for that, some practical, but one of the main reasons is that the research really doesn't show us that there are many differences between the specific types of problems that children experience depending on their health condition. Obviously, the treatments, the experiences of the symptoms of the condition are different, but when it comes down to children's behaviour and how they adjust, it doesn't seem to matter so much what the condition is or how severe it is. It seems to be down to other factors. That's why we tend to focus more broadly rather than at the specific condition level. But I'll talk more about that a little bit later as well. So first of all, by way of a little bit of background, I imagine most of you know exactly what a childhood chronic illness or a childhood chronic health condition is. But officially, it's usually defined as any kind of ongoing impairment that's characterized by some sort of physical condition that causes the use of services, health services, beyond routine care. What we do know is that a lot of these chronic health conditions, like asthma, eczema, diabetes, juvenile arthritis, are fairly common, and the rates do tend to be on the rise in Australia and around the world. We don't really know very much about why the rates are increasing. There are lots of hypotheses about that, but we do know that the rates of these conditions are increasing. It is a significant problem for families, for children, for their parents, and for communities. The reason that it's a significant problem, there's a number of reasons. First of all, the burden of illness tends to be greatest in childhood. So for a lot of these different health conditions, most of the impact is greatest in childhood. Some children will grow out of some of these conditions later down the track, although of course that's not the case for all conditions and not for all children. But in the majority of cases, the burden of illness, so that's the impact on children and families, tends to be greatest in childhood. Because we're talking about children here, the conditions impact not just on the child themselves, but also on their family. So in terms of family routines, in terms of what families do on a day-to-day basis, and obviously there's a much, much greater responsibility for parents to have to manage and treat the condition. We also know that parents have to go through a whole range of different medical procedures, medical services, medical treatments to assist their children manage their condition. And again, this is different for each health condition. We do know that adherence with these medical treatments is low, and that's a real problem. And a lot of the time, treatment is expensive and complicated. So I think sometimes it can be seen as you simply give some medication or you do some physical exercise or therapy, and that's it. But usually it's much more complicated and involved than that. We also know that for children with chronic health conditions, they do tend to suffer more behavioural and emotional concerns. Now, we know that some misbehaviour is normal. All children have misbehaviour and difficulties with managing emotions at different stages. So this is perfectly normal, and every parent will experience this. And some discipline problems are obviously inevitable too. Every parent goes through some difficulties. But as I said, we do know that children suffering a chronic health condition are more likely to experience difficulties with their behaviour and emotions. And part of the problem is that these difficulties with behaviour and emotions can actually make the illness worse, and therefore your parenting more difficult. And they can impact on adherence too, because it's much more difficult to get a child to do some part of their treatment or their therapy when they don't want to do it, when they're not listening to your instruction, when they're anxious or worried about that treatment. So children's behaviour and emotions in this problem are particularly challenging. We also know that there is this interaction between behaviours, emotions and health. So that if a child is not feeling well, if they're stressed, they are more likely to experience health symptoms. And that's more likely to impact on their behaviour. We all know as adults, if we're not feeling well, if we've got the flu or a cold or a virus of some sort, we tend not to be as patient, we tend not to be as engaging with our children as we might otherwise, or with our in our other relationships. For children, it's even more so because they're less able to control their behaviour and their emotions. So the cycle for children in terms of their behaviour, their emotions impacting on their health symptoms is much more difficult. So the question is, why do children with chronic health conditions have problems with behaviours or emotions? Now, they have behavioural or emotional difficulties for all the same reasons that any child will do. Okay? And I'll talk more about that a little bit later. But there are also some additional considerations. So, for example, there are limitations that are due to the illness that might make them not be able to do particular things or particular activities. Certainly there can be an impact in terms of school and peer relationships. Depending on the condition and how visible or obvious it is to other children, they may experience reactions from their peers or friends. They may have feelings of helplessness, anger, self-consciousness, and worry in relation to that. And of course, there are a whole range of parenting traps that parents might fall into as well. For example, parents might become so involved in their role as parents and focused on their child's needs that they actually neglect themselves. And looking after ourselves as parents is very, very important. Parents might also change their expectations of children in order not to make their child's illness worse. And we do know that sometimes excessive attention to these types of illness behaviours can also be an accidental reward for children. And of course, the family stress associated with having a problem with the child's behaviour or emotion and the child's illness can make the child's behaviour more difficult. And there are a whole range of other things that impact. And again, this depends on the child's condition. For example, the interaction between other caregivers, between childcare, kindy, school systems, and all the other people who are involved in the child's care can also make it more difficult in terms of managing children's behaviours and emotions. We do know that parenting and the family environment should impact on children's health, both directly and indirectly. So when families are stressed, that impacts on how they parent, or when parents are stressed, rather, that impacts on how they're parenting. So, for example, I'm sure you've all experienced this. When you're feeling stressed for whatever reason, whether it's to do with your child or not, you're less likely to be patient, calm, and persistent with your child, and that then impacts on children's behaviour and their health and well-being. We know that parents matter quite significantly in children's health because some parenting factors and family stress can actually predict illness onset and disease course. And we know that positive, confident, and effective parenting leads to better management of chronic health conditions and better child adjustment. So does that mean that parents cause children's illness? Of course not. What it means is that when children are experiencing stress, their illness is likely to be more problematic. Now, parents need to integrate a whole range of parenting strategies for general behaviour and tasks relating specifically to the child's condition. So what that means is they need to do all of the same things that every parent has to do, plus a few extras. They need to closely monitor the child's daily activities. So they need to be on top of where their child's illness is, what symptoms they're experiencing, and so forth. They need to administer medication and any other medical interventions or therapies. They may have to respond quickly and effectively to medical emergencies. Again, it depends on the type of health condition, obviously, the extent to which that is a major concern. They have to try to provide the child with developmentally appropriate play and social experiences. So this is one of the critical things that parents often struggle with, is how do you manage trying to provide as normal upbringing to the child while still managing the limitations of the illness. Parents also have to help children manage their emotions. And again, this is something that all parents have to do, but children with a chronic health condition are more likely to be to worry, to feel anxious, and so forth. And parents have a role in helping them with that. And they have to develop effective homeschool communication and partnerships. And this is one of the things that our research has identified as particularly problematic for a lot of parents, being able to manage that homeschool relationship well and make sure that parents feel confident in the care that their child is receiving outside of when they're not with them. So what are some of the common parenting traps that parents can fall into? Well, first of all, parents might have different expectations for behaviour. So because they know that their child is unwell, or that they know that their child has a particular health condition, they set the bar in a different way. So they might have lower expectations. They might expect less from their child. We also know that parents will often discipline their child less often and more inconsistently. And there's a fairly straightforward and simple explanation for this that is perfectly logical on a day-to-day basis. So anybody who is a parent knows that when the child is sick, they tend to let things slide a bit more. They tend to let things go a little bit more, make allowances for their child's behaviour. Now, when you do that every now and again when your child's unwell, that's not likely to contribute to your child's behaviour. But when you have a child with a chronic health condition, the trouble is that they're often unwell, that there's often difficulties with their health. And so if, as a parent, we're responding to that by not being consistent in how we discipline children, that can make children's behaviour worse. Parents sometimes are in disagreement about the severity and management of their child's condition. So this can be disagreement between parents, but it can also be disagreement between different caregivers of a child. And sometimes parents are simply reluctant to discipline their child to prevent their child getting upset, and that makes the condition worse. So once again, part of the trouble is that if you're worried that your child will have a flare-up because they get upset or have a tantrum as a result of your discipline, if you do that every now and again, probably not going to make much of an impact on your child's behaviour. But if your child's experiencing lots of difficulties with their symptoms and that becomes a more common pattern in the way that you interact with your child, that can certainly start to impact on their behaviour. One of the things that we need to be thinking too about children's behavioural and emotional adjustment is not just about how we discipline children, but to think about the sorts of skills that children need to develop. And again, in order to raise a healthy, happy, resilient child, it's helpful for parents to focus on these types of skills. So children need good communication and social skills. They need to be able to express to other people how they're feeling, what their needs are. They need to be able to manage their feelings, to self-regulate their emotions, to express their feelings in a positive way, but also to respond to other people's emotions in a positive way. They need to have a whole range of independent skills, ranging from brushing their teeth to being able to manage their homework and so forth. And finally, they need problem-solving skills to deal with both the tiny problems in life, but also the more complex ones as they're getting older. So I guess the question becomes, what can parents do? How can parents help? How can they reduce the likelihood that their child will have behavioural and emotional problems? And how do we build some of those skills in children, particularly when our child does have a chronic health condition? So our research at the Parenting and Family Support System focuses on the Triple T Positive Parenting Program. And we've been working on a version of the program called Healthy Living Triple P, which is for parents of children with a chronic health condition. And I wanted to share with you some of the tips and ideas and strategies that we have included in that version of that program that has shown to be effective with parents of children with chronic health conditions. We've particularly trialled this version with parents of children with asthma and eczema, and at the moment we're working with parents of children with diabetes as well. So I guess that the starting point is really to try to ensure that we prevent illness problems in the first place. So what that means is trying to ensure that you have good illness, or that your child rather experiences good illness control. This means following whatever the prescribed illness and lifestyle management plan that's recommended by your child's doctor. You need to understand what the key steps of that illness management are and why they're important. And part of that is having discussions and regular reviews with health professionals. It's also really important to encourage your child to continue with their regular activities. Now, this can be tricky because sometimes there can be lots of things that get in the way. Our child might have flare-ups, they might have treatment that's incompatible, there might be triggers in the environment that make their condition worse. For example, going swimming might not be appropriate for some children. If that's a regular activity that they have previously engaged in, that can be tricky. But it is really important to try to find things that your child can do on a daily basis that they enjoy and that help them to be with other children as well. It's also really important to have realistic expectations. So I guess what I'd ask yourself at this stage is what you expect of your child. Can your child understand and do what you expect of them? And are you expecting perhaps too much or maybe too little of your child? Having realistic expectations is important in deciding how to respond to children effectively and also to reduce your stress as a parent. So from an illness management perspective, you need to know what your child is actually able to do and what steps need to be done by you as a parent. I think it's also important to ask ourselves what we expect of ourselves as parents, and are those expectations reasonable? Because like I said earlier on, one of the challenges for parents of children with a chronic health condition is that there's not only the day-to-day parenting task that every parent has, but there's a whole host of additional things we have to manage. And that puts many expectations on parents. So I guess that's something useful to ask yourself, what you expect of yourself, and is that reasonable? Are you being too hard on yourself, perhaps? Another key thing is really to try to reduce family stress. As I mentioned before, then we know that stress in the family can make children's illness worse because it makes a child feel more upset and anxious. But it can also act indirectly because you as a parent are less able to monitor and manage your child's illness effectively. So preventing or reducing stress in the whole family is good for children, but it's also good for the whole family. And certainly we do know that having a child with a chronic health condition actually increases family stress. So this is something that's really particularly important to think about. So there are some obvious things that we can do. Rest, healthy food, exercise are all important elements of reducing family stress. Finding support, so finding other people that you can rely on, sometimes just for a chat or a conversation, but also the sort of practical support in terms of caregiving that is really, really vital for families. Taking a break is also essential, so taking a break from parenting, having some time out from your child is perfectly normal and healthy, but also having time out from your day-to-day responsibilities, work, and so forth. Daily routines and having regular family routines is particularly important in the context of children's chronic health conditions. Routines are important for all children, but because there's usually additional things you have to do to treat children's health conditions, it's so much more important that those routines are in place, and it makes life easier for everybody. And finally, it's also important to organise regular family times together. Now, these don't have to be big outings or expensive activities or anything like that, but having times together as a family where it's just fun and engaging for everybody is really quite an important way to reduce stress as well. Another thing that is quite important is balancing work and family. And again, we know in the context of children's health conditions that because they're stressful for parents, because there are additional roles you have to take into account, because often parents have to take time off work because the child is unwell or to do various health and medical appointments, that balancing work and family becomes much more challenging. And we have lots and lots of anecdotal experience from parents who say to us that often this is just impossible and that one parent has simply stopped working to try to reduce the level of stress on the family. But clearly that's not possible for everyone, and it might not be desirable for everyone. So I think this is something really important to think about. So think about what your real expectations are of yourself. Think about whether there are any commitments that you have that you can reduce. For example, can you get some outside help for tasks around the house? Or is there a way of limiting children's after-school activities, for example, on certain nights of the week, so that there's just a little bit less in the whole family life to manage? Another thing that we know is also particularly important is developing good transition time routines. So what that means is transitions between home and school and work, and at the other end of the day, transitions between school, work, and home. We know that when we come home and we have a good transition, we avoid conflict, we're more relaxed, the whole evening is likely to go better than if we experience conflict in the very first few minutes with our children. So having good transitions is particularly important. I can't emphasize enough the importance of teaching children to be independent. That's a skill your children need to have anyway, but in the context of balancing work and family and making those transitions easier, the more your child is able to manage for themselves, the easier it is on you and the entire family. And finally, it's obviously vital to have good, reliable childcare. And as I said earlier, this is one of the key things that parents are often very concerned about, is making sure that they feel that they can trust and rely on the caregivers that are looking after the children when they're at work or in other situations. One of the other things that is really important to think about is reducing children's stress and anxiety. So children do need to learn to manage their own stress, and in order to do that, they first have to recognize when they're experiencing stress, and parents can certainly help by modelling, labelling emotions, and monitoring their child's behaviour and emotions. So in order to reduce children's stress and anxiety, one of the key things is to make sure you talk to your child about the illness. Talk to them about realistically, obviously this depends on their age and their developmental level, but the more opportunity your child has to feel like they can share their worries about the illness and their concerns about it, the better. Part of this is also making sure that you're listening to your child, because what children worry about is often quite different to what parents worry about. As an example of this, there was a neat little research study that I often refer to that looked at parents and children's concerns in the context of asthma. So the major concerns that parents of children with asthma reported was obviously things like the child having an asthma attack. That was the parents' number one concern, and the possibilities around having to visit emergency and so forth. What was children's number one concern? Having to cough, worrying about coughing at assembly in school. Now, when you think about it, in the grand scheme of things, that's a pretty minor worry, especially given the potentially life-threatening nature of the health condition. But for children, that's what's important to them. And so as parents, we have to be prepared to listen to what their worries and concerns about are and to help them with that. So talk openly about their feelings and how to cope with upsetting events. Find ways to help them deal with those. Monitor your child's feelings and anxieties so that you can see any ups and downs in the sorts of situations that make it to respond when they're feeling more anxious or more worried. Encourage your child to recognize when they are experiencing stress or anxiety so that they can actually see the signs of anxiety and therefore perhaps tell you about it or do something about it. And then, of course, there are things that you can do to help your child to learn good coping skills. So first of all, it's really important to find some relaxing activities. So these are things that help them to relax, whether it's sitting down with a book or imagining something positive or playing with a particular game or activity. Everybody has a unique and different way of relaxing, and it's helping your child to identify what works for them. Breathing sounds a bit basic, but we do know that slowing down breathing and you using a very kind of relaxed style of breathing is quite helpful in terms of managing anxiety. So if they're feeling like their anxiety is rising, like their stress level is increasing, if they just focus on the breathing and breathing slowly and steadily, that can certainly help in terms of, that's certainly a helpful coping skill. Saying positive, helpful things to themselves like, I can cope, I can do this, are also really important things. Sometimes giving them a few key phrases, maybe even putting them on a little card in their pocket can help. Now, these positive, sorry, that didn't come up today. Now, those positive, helpful thoughts, again, are unique to your child. So what works for one child won't work for another. Now, you know your child best, So you're in the best position to help them figure out things that they can say to themselves that are meaningful to them, that make them feel better in these situations. And finally, it's really important that they develop good problem-solving skills as well. So how to find ways to solve difficulties that might cause them anxiety or stress is really important as well. One of the things that is often left out, but that we know is also very important in the context of chronic health conditions, is siblings. Now, some siblings may also have a health condition, the same one or a different one, but not all siblings do. A lot of siblings don't have. We do know that siblings tend to worry about their sibling, and they are impacted by the health condition in their family. So it is really, they're also often left out because, especially if they don't have a health condition, if they're doing well, it's easy to overlook their needs simply because life gets busy and stressful and other things are, come up to the top of their priority list. But it is really important to talk to children, to siblings, about what is happening so that they understand and that they feel involved in their siblings' life. Again, listen to their worries or concerns. Their worries or concerns might be, again, radically different to the child that has the health condition, to yours as a parent, and they might be quite surprising. So it is important to listen to them. They may very well be worried about their brother or sister and what's happening to them. Encourage them to ask questions. So let them know that you're always open to listen and to hear what they have to say. Set aside times to spend with them. The nature of having a chronic health condition means that there's usually management of that condition. And so naturally what that means is that more time will be spent with the sibling that is unwell. So that's why it's so important to make sure that the other siblings, the other brothers and sisters, do get time with parents as well. It's also really important to include them in their siblings' lives. So sometimes it can feel almost like it's better to kind of isolate, to keep them away from the problems, to keep them away from the treatments. But in actual fact, it's usually better if the siblings are involved, if they know, they understand what's happening, and they help to the extent that they can. But it's also important not to give them too much extra responsibility. So I guess the trap can be that if the child is doing really well, they can feel the sense of responsibility for doing things around the house and for looking after their brother or sister. And that's not a bad thing, but too much responsibility can also be harmful, because what that means is that they'll often take on the worries and anxiety related with that as well. Things that they can't necessarily manage at the age that they're with. In terms of managing your child's illness, a few key things that again are fairly straightforward. It's important to find out about the illness. The medical health professional, GPs and so forth are the best source. Google is also a source of all sorts of information, but again, be wary about that because there is a lot of misinformation and a lot of things out there that can be confusing and conflicting. It's important to keep track of your child's illness so that you're monitoring any improvements or any deteriorations in your child's condition. Do be sure to involve your child. It sometimes can be tempting to just do things for them, but the more they're involved in managing their own illness, the better usually they are. It's very important to work as a team with other caregivers so everybody's on the same page in terms of how to best manage the child's health condition, and to reach an agreement about how best to do that. Now, I talked at the beginning about the fact that children with chronic health conditions have more likelihood of having behavioural and emotional problems. So I guess one of the important things to consider is how do we prevent some of those problems, and then how do we manage those. So I wanted to spend the next little while talking about that. One of the things that is important is to develop predictable routines with children. So the more likely, the more routine you have, the clearer the expectations, the clearer the rules you have about children's behaviour, the easier it is, or the less likelihood there is that they will experience behavioural problems. It's also really vitally important to encourage behaviour you like. So to notice and pay attention when children are behaving well. And the most important way you can do that is simply by giving attention to it, but you can also praise children's behaviour. And generally speaking, the more specific you praise, the more descriptive you praise. So the more you describe the behaviour you like, the more effective it's going to be. And when I say more effective, the more likely it is that your child will continue to do the behaviour that you like rather than the behaviours that you don't like. So in terms of managing treatment routines and the sort of steps to prevent problems, it's a good idea to have that regular routine, to prepare your child ahead of time, to let them know that you're going to be engaging in the treatment. Have everything ready so that your child isn't sitting around waiting for things, because that can get terribly boring and can increase the likelihood of problems. As I've said before, involve your child, and this means different things at different ages. Clearly, involving a 3-year-old is quite different to engaging a 10-year-old in their treatment. But at each age, depending on your child's age, it is a good idea to make sure that they're involved. It's an opportunity for you to spend some quality time together. Calmly tell your child to come and take their medication or treatment, and be sure to praise and reward any appropriate behaviour that you see. So then, if we're thinking about managing problem behaviours, I guess the important thing here is in relation to discipline. And we know that discipline helps children learn to accept whatever necessary rules and limits are in place, to help them to develop self-control and the ability to be able to self-regulate and self-manage their emotions and their behaviours. It's also important to help consider other people and the impact that their behaviour has on other people. Discipline also helps children to learn to express their feelings in a way that respects the needs of others. So to be able to say that they don't like something or they don't agree with something in a way that isn't negative or aggressive. And it also helps them to learn to take responsibility for their actions. So reasonable limits and boundaries are really vitally important for preventing and reducing problems with behaviour. They also tend to help children to feel more secure and to know what is expected of them. And I've said earlier that expectations are really, really quite important. In general, discipline tends to work best when it's immediate. So when you immediately back up an instruction that you've given, when it's consistent, so that when you do the same thing each time a particular misbehaviour happens, and when it's decisive, so that when you, rather than trying a sort of an escalating series of different strategies, when you respond quickly and decisively to that behaviour. So discipline tends to work best when children live in a predictable world. So what that means is that when they've got a predictable routine, a predictable set of rules and expectations about their behaviour. It tends to work best when children receive lots of attention for good behaviour. Children are much more likely to respond to attention, positive attention for good behaviour, and increase the level of good behaviour if parents pay attention to it, particularly if they praise it. If parents have reasonable expectations and have reasonable rules in place, and this is both of themselves and of their children, discipline tends to be more effective. When you use fair and predictable consequences consistently, that's really important as well. And when parents support each other and back each other up, discipline is likely to work better as well. So when parents are in disagreement, children very, very quickly pick up on that and will often say things like, well, I'll just go ask mum or I'll just go ask dad. So it is very important that parents work out how they want to discipline their children together as a team. All right, so let's turn now to talking about how to teach your child limits. So I guess the first step is to be really clear, to provide very clear and calm instructions to your child. So to tell your child exactly what it is that you want them to do or anything that you don't want them to do. So, for example, stop jumping on the bed is jump outside on the trampoline is a clear instruction that tells your child what not to do and what you'd like them to do instead. If you say something like, well, stop doing that, it doesn't actually tell your child what it is that you want them to do and what you want them to do instead. Now, one of the things that can often happen is that we tend to repeat our instructions over and over and over again until our child finally potentially gives in. And that's what we often call an escalation trap, where parents starts by being clear and calm and then gets louder and louder and louder until eventually their child does as they're asked. One way of avoiding that kind of escalation trap is to follow our sort of rule of thumb, to give 2 instructions only if it's a starting instruction. And by starting instruction, I mean to start a new behaviour like packing up toys or coming to the dinner table, and only a single instruction if it's something that you want your child to stop. So stop hitting or stop yelling, something along those lines. So those would only be a single. So 2 instructions if it's a starting instruction, 1 if it's a stopping instruction. And then back it up if your child doesn't follow, rather than just repeating the instruction over and over. Praise cooperation. So if your child does follow your instruction, be sure to give them some praise, and particularly to give them some descriptive praise. I really like the way you did what I asked as soon as I asked just now is very important. That praise and attention that you give to your child if they do what you ask them to do is really vital. If your child doesn't do as you've asked, it is really important to make sure you back up your instructions. And there are a number of different options, and unfortunately I don't have a lot of time to go into these, but just very briefly, you can use what we call logical consequences, and this is where you, for example, take away a toy or a problem that's been, or a problem activity. So for example, if your children are fighting over some toys, a logical consequence would be to take the toy away from them for a brief set period of time. The important thing about logical consequences is that you return the activity to your child to give them a chance to show the correct behaviour. So logical consequences tend to work best when they're brief. Okay, so you might take something away for 5 minutes, then give it back to them and remind them again of the rules about sharing or about being gentle with toys or whatever the problem was. One of the other options is to use either quiet time or time out. Both of these rely on you being calm and telling your child exactly what the problem was, and then taking them either to quiet time, which is somewhere on the edge of the activity that they've been involved in, or to time out, which is away from the activity that they've engaged in, to a space that's boring but safe. So usually a child's bedroom is probably not the best time-out environment. A lot of parents use things like a toilet or a bathroom or a spare bedroom. The key to either quiet time or time out is not so much how boring that environment is, but how positive, engaging the time-in environment is. So what you want to do is to be able to create a contrast between time in, which is fun, which is great to be in, which is where your child wants to be, and time out or quiet time, which is boring, unexciting, with nothing to do and with none of your attention. Both quiet time and time out work best when they're brief. So a couple of minutes is usually enough, as long as they follow the rule. And the rule of both quiet time and time out is that they have to be there quietly for the set period of time. So either for quiet time on the edge of the activity or for time out in the other space. There's no evidence that it works any better if you take your child there for longer periods of time. So it's best if your child is misbehaving. So for example, if they're hitting their brother or sister, to give a clear instruction, stop hitting your brother, for example. If your child follows the instruction, make sure to praise them. Thank you for doing as I asked straight away. And if they don't follow your instruction, to back it up. And you might say something like, you're still hitting your brother, so now you're going to quiet time and you have to stay there for 2 minutes quietly. The important thing too about quiet time and time out is that it's both parent initiated and parent completed. So parents send their child to quiet time and time out, and parents take their child out of quiet time and time out. A final option which can be helpful to teaching children limits is the use of behaviour charts. Or star charts, as many of you might be more familiar with. And this is simply where you offer your child some tangible rewards for following a particular set of rules. So your child might receive some stickers or some smiley faces or some ticks on their chart whenever they follow a particular rule. And once they've earned enough stars or stickers, those can then be exchanged for some sort of reward. Now, the kinds of rewards that tend to work best is time with you. So reading an extra story at bedtime, going to the park, having some time to, watch a special family movie, choosing what dinner will be for the night, something along those lines. It does not have to be anything expensive or even time-consuming. Behaviour charts are best used for a brief period of time for a very specific behaviour. So think about what behaviour you want to encourage and explain to your child that they will earn stickers or stars for engaging in that behaviour. So for following instructions or for packing their school bag or whatever it might be that you want to encourage. And then explain how they will earn those stars or stickers and how they will earn the rewards, and then trial it out. The other really important thing about behaviour charts is that you phase them out, so that you start by making rewards easy to be earned and then gradually make them harder and harder until you get rid of the star charts altogether. They are meant to be a short-term strategy. A few weeks to maybe a month of using a behaviour chart is usually more than enough. Like I said, I don't really have time to go into any more details about these strategies, but there's certainly more information available through the Parenting and Family Support Centre website and through Triple P as well. Our research at the Parenting and Family Support Centre does focus on supporting families and particularly on the Triple P Positive Parenting Program, which is the kinds of strategies and ideas that I've just been talking about really stem from that program. And as I've mentioned, a lot of the research that we're doing at the moment looks at whether these types of parenting programs or parenting interventions like Triple P can actually make a difference for parents of children with a chronic health condition. So some of the questions that we've been working on or are still working on are things like, well, can something like Triple P or a parenting intervention enhance parenting? And there's certainly evidence that it can. So we know that parents who take part in Triple P are more likely to feel more confident in their own parenting. They're more likely to use effective strategies. We also know that these kinds of parenting interventions are likely to lead to lower levels of emotional and behavioural problems in children. So children do better as a result of their parents participating. We also know that families tend to do better. They tend to be less stressed, less anxious, less worried. They get on better. There's better communication. So certainly taking part in something like Triple P can help parents and children and families in all of these different ways. Some of the things we still don't really know, don't have an answer to, and this isn't just relating to Triple P, but parenting interventions in general in the context of chronic health conditions, is whether we can impact on adherence. As I said at the very beginning, adherence is a big problem, and part of the adherence issue is that children's behaviour makes it more difficult for parents to adhere. That's one of the questions that we're really testing at the moment, is trying to see whether if we can make parents' job easier, if we can reduce children's behavioural problems, whether we can actually impact on adherence. And similarly, whether we can impact on children's actual health symptoms. We've got a little bit of a hint in our asthma and eczema work that parental monitoring suggests that for children with both asthma and eczema, the children's health gets better as a result of a parenting intervention. But at this stage, it's just a very hint of that. And the other question that we don't have an answer to at the moment is, does it matter what the health condition is? So far, the conditions that we've worked with, parents have reported that their strategies are helpful, that they like them, that they seem to be helpful. But we really haven't tested, and the research really hasn't tested all of the different types of health conditions that children might experience. So we have some answers to some of these questions, but there's still a lot of work to be done, and certainly the participation of parents in our research programs is really one of the things that helps us to answer some of these questions. So I guess to finish off, parenting is not an easy job for anyone. It's full of positive things, it's full of love and laughter and joys, but it's also full of struggles and responsibilities and lots of decisions. That's the journey for all parents. And I think for parents with chronic health conditions, this is even more so the case. And really the research that we're doing is trying to make that journey a little bit easier and a little bit more relaxed in some ways. So thank you very much for your time and attention today. I've left my email address there on the slide if anybody wants to contact me at any stage. But I guess this is the moment where we turn over for questions that you might have. So thank you again for your attention.
Thanks very much, Alina, for a very informative and interesting presentation. I know you've provided quite a few practical tips that could help. We have had a couple of questions come through, so if you do have any questions, you can type them in the box on the left-hand side now. The first one that we've got come through, Scott, you've sort of given some good examples on how to reward a child and the importance of giving rewards and sort of praising good behaviour. Have you got any sort of tips? I know you spoke a little bit about the logical sequences and quiet time. Sort of any tips around good ways to discipline a child when they're misbehaving?
Yes, I suppose that I saw that question come up, and I knew that the answer to that was coming up later. So, I mean, the kinds of things I said about using things like clear, calm instructions, logical consequences, quiet time and time out, but are all really important ways to manage misbehaviour. But I really can't emphasise enough how important that prevention is, to really try to set things up so that the likelihood of behaviour problems is lower. And that's partly about the expectations we have, about the rules we have in place for children, about the routines we set up, and about how we encourage the sorts of behaviour that we like. Now, that isn't going to solve all the problems, of course, but it's just going to minimise the number of problems you have to deal with. And that's always a good thing. Yeah.
Great. We've also sort of had a comment sort of around school, and Kate sort of asked, how do you recommend parents and teachers assist in the transition to school when a child has a chronic illness such as JIA, with the aim to prevent bullying and isolating the child?
Mm-hmm. Yeah, look, that's a really tricky one, and certainly our research and our work with parents, that's one of the biggest concerns, is about how parents communicate with other caregivers, whether that be childcare or kindy or school or any other sorts of settings. The sorts of things that we always try to encourage parents to think about is really partly about educating the other caregivers. So as a parent of a child with a health condition, you are the expert, usually not only on the health condition, but also on your child. So sharing that expertise with the other caregiver, with the teacher, is really quite important. Teachers in particular, school staff, may simply not have the information, may not know what impact it has on the child. So having meetings regularly with teachers and with school staff is important. Sharing information, sharing any management plans that are relevant for your child is critical. One of the things that we do find, and this is feedback from teachers too, is that teachers often feel like parents only come in when there's a problem, or when there's something going on. And what can actually help is if you as a parent make sure to set up regular routine catch-ups with teachers, so that you're not only just going in when there's a problem, but managing and monitoring how your child is going and how the child's teacher is managing things on a regular basis. That can help to keep channels of communication open. It can make it easier for you, and it can also make it easier so that you don't feel like you're being called in just when there's a problem. And likewise for the teacher, it doesn't feel like a time is being set up simply because there's a problem. So when you know that your child is perhaps more likely to experience difficulties, having that regular open communication is really vital.
Yeah. Do you think it's quite important to talk to other children at the school, or even around helping your child prepare for reactions of other students, or sort of ways that they can sort of explain their condition and sort of have sort of some of those answers ready?
Yes, absolutely. I mean, I think both points there about giving your child some words or some strategies to talk to other children is important, but perhaps also educating the other children. Now, I think children can be incredibly caring and empathic, and they can also be incredibly hurtful and aggressive towards other children. So I guess what we want to do is to activate that helpful, caring, empathic response. And if that can be done at a whole classroom level by the teacher with the help of the parent and the child, that can be a really nice way to make that transition to school easier. Yeah. But certainly we also know from our work, we've done some work with parents of children who've been bullied, and this isn't children with health conditions, just children who are bullied in general. We do know that arming children with social skills and with strategies and with ways to help them interact with peers and to facilitate, and parents actively facilitating peer interactions is really important to making sure that children experience less bullying. So sometimes we think bullying is a school sort of thing, but actually parents can do a lot to help prepare their child in that setting.
Yeah. We've had another question. You and you were talking a little bit around siblings and talking about, giving attention to other siblings and in the family. What, in your experience, what are some of the common signs of siblings who are acting out because they are not getting enough attention?
Yeah, again, this differs because some siblings will misbehave, and that will simply be to try to get the parents' attention. And we do know from all parents that misbehavior tends to get your attention. And this is precisely the reason to focus on the positives, because if you focus on the positives, your child is less likely to have to misbehave to get your attention. But the other thing that is probably even more common in siblings is more the anxiety and worry, because sometimes they're not as involved. Sometimes parents don't talk to them, or they're not quite sure about what to say. They don't want to worry the brother or sister. And so the sibling can kind of make things up or, worry about things that are not actual problems. So keeping an eye on that is probably really quite important too, because it's easy to see the misbehavior. It's not so easy to see the worry and anxiety that the child might be experiencing.
Yeah, that makes sense. Just one quick question. Also, you spoke sort of around put a high value on ensuring that the child is independent and does things independently. For someone sort of, working on that, do you have any sort of tips on how to get the child to do things more independently, where you might have been doing more for them?
Okay. Sorry, just dropped out a little bit there, but I think I got the idea that it had to encourage what sort of tips to encourage independence in children. There's a whole range of things. I mean, there's a whole range of strategies. We use things, for example, like a strategy called Ask, Say, Do, where we think about how we break down a task into smaller steps and ask the child, well, what's the first step? What's the first step in brushing your teeth? Okay. And then if they can tell us, we praise them. If they can't tell us, we say to them, well, the first step is we take out our toothbrush and put the toothpaste on it. And then if they can do it, we praise them for doing it. If they can't, we offer the assistance. So sometimes it's just about breaking tasks down into smaller steps and helping children learn the smaller steps at the same time. Sometimes children actually have the skills, but it's faster for us as parents to do it ourselves. So in terms of independent skills, it's sometimes about picking your moment, working on a particular skill or task when you know you have more time. So the morning rush hour is not likely the best time to teach your child independent skills. It's better to do it on weekends or on holidays or something like that, where you've just got that little bit more time to do it in preparation for that morning rush hour. So picking the time is often really quite important.
Yeah. Well, once again, a sincere thanks to you, Alina, for providing us with such an interesting and informative presentation this evening. I'd also like to thank all the participants who have joined the webinar tonight. Could I please remind you to take a few brief moments to complete our exit survey, which will come onto your screens now. So thanks and good night.